Welcome back, everybody, to the OPT Network as we continue to talk about the ravages of Hurricane Laura and not only the damage that it left in the wake of central Louisiana, but also the health care that people really struggled with during the hurricane. Our guest this morning is Marie Simpson, one of our partners from Christus Cabrini Hospital. Marie is a certified diabetes care and education specialist, joining us to talk about diabetes in the aftermath of the storm. Marie, good morning and welcome back.
Thank you for having me.
Absolutely. You'll see Marie is masked up, not only for safety, but because she too is diabetic. So this has been the protocol at the hospital.
Yes, if you enter Cabrini Hospital, then you need to have a mask on. And they will have masks there at the entrance.
For you. And it's an effort to keep everybody that's coming in and out, including staff and patients, well.
Yes.
So a lot of people lost power. A lot of people, only God knows what they did during those days of not being able to have insulin refrigerated or not being able to take their medicine. Talk about the toll.
Well, a lot of people have, as you said, lost refrigeration. They've lost electricity. And a lot of people have had their houses actually smashed in, and they're just unable to get to their supplies that they need to manage their diabetes.
And were you all overwhelmed in the wake of that?
I wouldn't say overwhelmed, because unfortunately a lot of people were actually, stuck where they were. So,
right.
As they've been able to get out of their houses, move trees to actually get out of the house, then we are starting to learn a lot more of these are real needs in our community. Mm-hmm. People need supplies, people need insulin, just need to be able to check their blood sugar.
Wow. So talk about what people could have done during the storm when most people lost meat, lost everything, and also their medicine.
Well, in the future, hopefully we can learn to put together sort of an emergency disaster care packet for everybody that has their own individual healthcare problems. Specifically for diabetes, that would include an extra meter, extra testing strips. In a perfect world, we'd like you to have, at least a few weeks worth of medication stashed away, and put, especially for insulin, put in something that can keep it cool. Insulin does not have to stay in the refrigerator to stay good, to stay viable, but it does need to be cool. It can't get hot. Mm-hmm. And so some of the things that could be used instead of, an electric refrigerator would be to get, those little insulated cups, just an insulated coffee cup, and put some ice cubes in that and store your insulin vials or pens in that.
That's a great idea. I never thought about that.
That way you don't have to worry whether the electricity goes off or not. The other thing that, the crafters out there probably already realize this, but there's water beads that you can get in the craft section at Walmart or Target or Amazon, and they were initially used in floral design, but they absorb water and they keep the temperature of the surrounding items cooler, several degrees cooler than the outside environment. Mm-hmm. So what we've learned is you could actually get some of those water beads, and as long as they stay wet, then they're going to keep it cool.
Wow.
So you can get water beads and like in a little Ziploc bag, put your insulin pens in there with it. It's not going to damage them. It's non-toxic, and it'll keep it several degrees cooler.
Had anyone ever really thought about the emergency situations like storms when it comes to the viability of their insulin or their insulin pens?
I think it's probably a fleeting thought if they thought about it at all. It's been how long since the last major storm?
Mm-hmm. It's been a while.
So we sort of get complacent and just expect that it's going to be there when we need it.
Right.
So that's why I think part of our education going forward will definitely be how to put one of those emergency kits together.
Sure. And in the wake of recovering and we're getting back to our normal where We just had our partners from CLECO come on and talk about restoring everybody's power and getting back up.
Oh, yes, thank God for those linemen and those power
Thank
people
God for
working
them.
in the heat through the night.
Right. Just to make sure that we're restored. But one of the things that Cabrini is doing is a diabetes disaster response. Talk about that.
Well, we were thankfully contacted by representatives from an organization called Insulin for Life and another organization called Diabetes Disaster Response Coalition. And in the aftermath of Laura, they knew that we were going to have people that need help. And one of the biggest concerns for them was helping people make sure that they are still able to manage their diabetes in the wake of this storm. So they reached out to us. They said, you're located in the center of the state, so you'd be a great hub. Can we basically partner with you in order to get in touch with the surrounding areas, find out what those community areas need, not just here in central
Sure.
Louisiana alone, but also in Lake Charles and Leesville and some of those other places that are really still don't have power at this point.
And in Lake Charles, it's probably going to be a long time.
Yes. And it's tough getting the word out because people don't have their internet
Right.
and things like that. So we're trying to spread the word as much as possible. They want to send us items, and they have already sent us one shipment that has lots of supplies, meters, testing strips, some insulins, and things just needed, that a person with diabetes would need. But they don't want to send items that aren't going to be used. So they're asking us, what specifically do members of the community need? Mm-hmm. So in order to find that out, we're asking people to share our phone number, get in touch with us, give us your name, your doctor's name, and what it is you need. Mm-hmm. And that way we can request that. And as soon as it gets here, we give them a call back. And we already have people lining up and coming to get their supplies now. We've already packaged up at least 50 bags of supplies to ship out. We've got some going to Lake Charles, another going to Oakdale, another to Leesville. So if they're not able to come here,
right,
then we can ship it.
You know, the thing that I'm concerned about, Marie, are all of the people who had to evacuate from Lake Charles and go to places like New Orleans and other outlying areas. And some really just left with what they could carry, what was available, and maybe just even the clothes on their back. And then we have people that are still sheltered at the shelter at LSUA. So let's take a break here, but when we come back, let's talk about how we connect with those people in need of their insulin or whatever medication strips that they may need. How do we connect with those people, and how do we connect each other so that we can get what we need? We're going to have more of this conversation right after this. Stay on point. Welcome back, everybody, to the OPT Network. Our guest this morning is Marie Simpson. She is our partner from Christus Cabrini Hospital, and she is the diabetes educator. And we're talking about how people are faring with their health, specifically their diabetes, after the storm. And we were talking about the diabetes disaster response. And I was mentioning those people that have been displaced. And during the break, we were saying we hope that their top priority would have been to get their medicine, but in chaos and confusion, and depending on how your home was destroyed, it may not have been. So what are we saying to those people right now, you think?
Well, one of the good things is that the state of Louisiana does have a Disaster Response Act, in that if you are involved in a disaster and you need to get your prescriptions, you can go to any pharmacy and they ought to be able to dispense at least about a month's worth, 30 days worth of medications, even before your next refill is due. And it shouldn't be any more of a copay. So there's that option.
Okay.
Another, as far as speaking with those who actually came out of Lake Charles, I know that there are doctors from that area that had stayed behind and are answering phone calls to write and send prescriptions out to these other cities, so that if they're over there, they can pick up their prescriptions wherever they are. The LSU Ag Center has a wonderful. They are prepared. I'll just tell you that.
Okay,
they
great.
are always prepared. They do a great job with what they do, and so they have a medical response team and things. So if people need specific items, specific medications, insulins, things like that, they have people that are in charge of, tracking who needs what and getting them what they need.
And so, in the midst of the pandemic, how does diabetes, we know we've heard so many people talk about those comorbidities or those underlying health issues that would, if a person would become infected with the virus, would make it more difficult to fight that off. How does that play into the mix of a pandemic, a horrible storm, one in which we've never seen for over 150 years, and coming together to keep people sane and well?
That is a tough task in and of itself, whether you have diabetes or not.
Right.
When you have diabetes, it is exacerbated by stress, unfortunately, because stress causes a liver response, and the liver releases a hormone called glycogen that releases extra sugar into the blood.
Wow.
So
who knew?
Any sorts of stress will do that to you. So there's that. But if you were to contract COVID, first of all, in the wake of a storm, COVID is probably not as high up on the list of priorities to be concerned about in most people's mind when they're looking at their house and trying to repair those things. But it's still out there, so we need to be vigilant and wash hands as much as we can and wear masks. But the other thing is that if they were to contract COVID, diabetes didn't make them any more likely to contract it as someone who doesn't have diabetes. But if they do contract it, good management of your blood sugars as much as possible. Staying hydrated is a huge part of controlling that. And then making sure that you go to the doctor and get treatment. It does make it harder to treat. It may mean that you experience symptoms longer. But honestly, we're not quite sure just how diabetes affects COVID in and of itself. We just know it makes it more difficult to treat and to recover from.
Wow. And not only is Marie Simpson a diabetes educator, she's also a nurse, along with many other things that you do in the hospital and in the community. Talk about Cabrini's efforts to make sure that the hospital is still safe for people who need to come in and seek care.
That's a great point. The hospital needs people, wants people to come and get their care. Putting off signs and symptoms of any condition is not encouraged. You want to come in as soon as if you're not feeling well, make sure that you get seen. To make sure that people are safe, some of the things that they're doing is offering hand sanitizers at each entrance. They've lessened the number of entrances that you can come through so that they can make sure that they help everybody as they come through the door. They're checking temperatures, and they're asking a couple of questions like, have you experienced any cough or cold recently? Are you running any fever? And if you answer yes to any of those questions, then we have protocols to make sure that we take care of you really quickly. You will get seen immediately by someone. And then as long as you're going to one of your regular doctor's appointments, they'll make sure that you have a mask regardless, if you brought one or not.
Good. And so we just want to keep hitting the point that the hospitals are safe. And if you have a condition that needs to be treated at the hospital, you are safe. Before we let you go, Marie, I just want to go back to the diabetes disaster response and people who are watching who have family members or who know somebody that is in need of any of these supplies, how do they best connect?
Have someone give us a call. They can call us at 448-4964. And when they call, they may get a voicemail. Leave a message. Make sure that you leave your name, your phone number, and so how we can get in touch with you if we don't speak to you directly.
Sure.
And then we're going to take your request down, let you know whether we have it in stock immediately and whether you can come get it now. If not, we are sending that request to these organizations to see if they have those available, and once they ship them and they arrive, then we'll give you a call back and make arrangements for them to be delivered.
And so one of the main things is that they don't want to just send out supplies in a vacuum. They want to make sure that if you or your family member or somebody that needs a specific item, that they have that, they get that information, and then they forward it to the person.
Exactly. So that we don't send you a dozen syringes if you don't take shots.
Right.
We need to make sure that we get you what it is that you need.
Absolutely. And again, give the number one more time, Marie, where people can connect and ask questions or get information that will help them.
Sure. Please give us a call at our Healthy Learning Center. That's 318-448-4964.
Absolutely. And one other important thing is to remain hydrated, to stay hydrated, especially as it's still so hot.
Yes. Make sure you drink plenty of water or sugar-free fluids. We don't want you to drink your carbohydrates, but regardless, make sure that you're drinking something.
Good. Marie, thank you so much, and thank Christus Cabrini Hospital for being the change that they want to see in our community.
Thank you for having us. We appreciate it.
Always. Marie Simpson, she is the Certified Diabetes Care and Education Specialist at Christus St. Francis Cabrini Hospital. Stay on point. We're back after this.